everyone, and welcome to part 2 of our video on hypertension. In this video, we're going to be answering the question, how do I know that I have hypertension? And we're also going to be talking about some of the measures or preventive measures that can be put in place to avoid hypertension or to manage hypertension. The only way you can know that you have high blood pressure or hypertension is by getting your blood pressure values monitored or measured by a healthcare professional, at least for the first time. This is because this healthcare professional is going to interpret the value to you and give you some counseling on how to deal with it. Also, you can do self-monitoring. You have your blood pressure machine and you take your blood pressure values at home. We will talk about how to take your blood pressure in another video, but these are the ways you can use to know if you have hypertension. Hypertension has no warning signs or no frank signs and symptoms that we can be talking about. That is why it is called a silent killer, because most people discover that they had hypertension when they already have complications like stroke, heart disease, or heart failure. So the real and only way to know if you have hypertension or not is by getting your blood pressure monitored. A lot of people always ask, how do I manage or prevent high blood pressure? There is only one secret. In fact, everybody is an open secret, as I can call it, because if you follow this, in fact, you are guaranteed that maybe your dosages, if you're already on medications, they can drop your dosage, the dosage of the medications you're taking, or you can live from pre-hypertension or high levels of blood pressure to perfectly normal values. And what is the secret? It is lifestyle modification. You have to modify your lifestyle. The best way to manage or prevent hypertension is by modification of lifestyle. Now, how do we modify our lifestyle so that we prevent hypertension? You have to have at least 150 minutes of physical activity in a week. It's not much. It just means that 30 minutes of moderate physical activity or exercising 5 days a week. 30 minutes 5 days a week. If you're up by 5 a.m. to 5:30 a.m. or if evenings suit you, 5 p.m. to 5:30 p.m. Moderate exercise that just lets you to break a sweat. I'm not saying that you should go mountain climbing or anything like that, or you should play football for 2 hours. No. 30 minutes of moderate exercise just to break a sweat. And if you do it consistently for 5 days a week, you will start seeing your blood pressure dropping. The second way is by stopping smoking. If you're using tobacco or you're smoking, you should try to avoid it. If you're living in a home where people are smoking you should avoid this kind of environment, because it will increase your chance of having hypertension. Having a healthy weight. If you're exercising, as we discussed, you're going to have a healthy weight, and this weight issue is going to help you as well to prevent hypertension from coming. Eating a healthy diet is another one. Your healthy diet, we're talking about reducing the amount of salt or sodium that you're taking, reducing your salt intake, and increasing your potassium intake. There is this mineral called potassium that the body uses to function, and it's very important. While reducing your salt, you're supposed to also increase the uptake of potassium. There are various foods that are rich in potassium, like bananas, potatoes, beans, and yogurt. Yogurt. They are very rich in potassium, and you should consume them more often, especially as you're reducing your salt intake. It is very good, highly recommended. You're going to want to eat a lot of vegetables and fruits as well. As you're passing, always buy fruits, apples, watermelons. It is going to help you tremendously. That's a point we're going to talk about, and is so important is how you manage your stress. You're going to want to manage your stress in a way that does not affect your blood pressure. You're going to want to learn about breathing exercises, because breathing exercises have been found to be very, very effective in managing stress. For example, your child comes home and maybe the child has not been going to school, you're asking for their report card and there is none. In fact, that child has not been going to school. It comes as a shock to you. But when this is happening, the first thing that should come to your mind is your breathing exercises. You want to breathe because you want to stay alive. You want to stay alive to help that child, to bring that child to the right path. But anyways, you want to stay alive, so you have to practice breathing exercises that will help you to manage stress. There are a whole lot of other things that you can do to manage stress. We will not be able to talk about that today, but we will eventually. So managing stress is a very important way that you can use to prevent hypertension or to manage your hypertension. Now, in addition to all these wonderful lifestyle changes that can change your blood pressure values, bring them to healthy ranges, there are some people who are hypertensive that need medications. The importance of medications are very clear. Their benefits are very clear. These blood pressure medications are able to bring your blood pressure within healthy values, healthy ranges, and are also going to help you to prevent complications from hypertension like a stroke or a heart failure. So when you're on your medications, you still follow your lifestyle modifications. They work very well together. Thank you very much, and I hope the video has been receptive. We're going to be following this up with another video on the complications and how to measure your blood pressure. Thank you and have a wonderful day.